Did you know that there are many studies out there that suggest that 30 to 60% of patients will not improve on their antidepressant medication? Is that you? Is your antidepressant not working? Well, in today's video, we're going to be talking about why antidepressants don't work for some people. We're going to discuss the factors related to depression, root causes that may be overlooked, what you can do to help mitigate those factors, and some lab tests to help identify some of those root causes and hopefully get you feeling much better. So, without further ado, here we go! So, what are some factors related to depression? Well, we talked about a lot of these factors in our video on how exercise treats depression, but I'll recap it here. Some factors that are related to depression or what causes depression can be neurotransmitter dysfunction or imbalance, such as serotonin, dopamine, and even your catecholamines like epinephrine, norepinephrine. Also, inflammation has been shown to have a huge impact on your brain and symptoms of depression. Decreased brain-derived neurotropic factor and decreased neuroplasticity is also associated and considered a factor in depression. And we talked about neuroplasticity in our last video, so if you missed that, go make sure to check it out. External factors are also something to consider when it comes to depression, such as external stressors, grief, and loss can all lead to reactive depression. And of course, there's genetics. Some people just have some genes that make them more prone to depression, or have some genes that we'll talk about that could predispose them to medical conditions and other factors that could be related to symptoms of depression. So, what are some of these root causes of depression? Well, some of these root causes are often overlooked because they're not really discussed in medical schools or even schools for psychiatric nurse practitioners like myself. I actually had to learn all of this after I graduated school, when I went into integrative mental health practices. And in doing so, I've discovered that depression and mental health symptoms in general could be caused by a lot of factors, such as medical conditions. So there are many medical conditions that can actually look like or mimic or make you more susceptible to symptoms of depression or even mental health symptoms in general. One of them that's very common is anemia. This could be iron deficiency anemia or B12 deficiency anemia. But if you have any type of anemia, your oxygen delivery to your cells is going to be poor. And you need that oxygen delivery for your cells to function and for that mitochondria to function well, to provide you with the energy sources that you need, and also to provide those cells with the energy sources that they need to function, including making neurotransmitters for proper brain function. Gut microbiome dysregularities could be another medical condition that is often overlooked. You could have gut dysbiosis, which is where bad bacteria are more abundant than good bacteria in your microbiome. And you see there's this big connection between your gut, which is considered now your second brain, and your actual brain. And we'll actually talk more about that in another video, so make sure you're subscribed to the channel, because that topic is a very huge topic and we're just touching on it here, but I want to go into more detail on it so that you can understand this connection much better. But just know that if you have any gut dysregularities, you're going to be more prone to mental health symptoms. Gut dysregularities or gut dysbiosis can lead to something called leaky gut, which can cause an inflammatory process. So inflammation, we already determined, is a factor of depression. And so any type of inflammatory process in your body can actually put you at risk for mental health symptoms. Now, inflammatory processes could be anything like we just said, leaky gut, and it can also be autoimmune conditions or even the foods that you eat. If you're eating more inflammatory foods, well, then that's going to put you more at risk for depression. Another medical condition that many providers tend to know about nowadays is hypothyroidism. Any problems with your thyroid, whether it be hypothyroidism, which is low thyroid, or hyperthyroidism, can cause mental health symptoms. But hypothyroidism is more associated with depression because it causes you to have low energy, low mood, and makes you feel very tired, which are all symptoms of depression. Diabetes is also another medical condition that can predispose you to symptoms of depression and mental health symptoms in general. And this is related to the blood sugar imbalances and more specifically insulin resistance. If your cells can't use glucose for energy, then you have a fuel delivery problem. And when you have a fuel delivery problem, your cells aren't being fed the nutrients that they need in order to function, in order to make good neural connections, in order for neurotransmitters to be synthesized, etc. And this can lead to a lot of other sequelae such as inflammation, but of course mental health symptoms as well. Now, another factor could be diet and micronutrient deficiencies. So we already talked about inflammatory foods, and we discussed that as well in the last video on neuroplasticity. But inflammatory foods such as processed foods and refined sugars can actually be very damaging to your cells and of course your brain. Also, if you're consuming a diet that is mainly processed foods and refined sugars and basically just junk food, well, then you're probably nutrient deficient. And if you're nutrient deficient, that's going to lead to mental health symptoms. Commonly, what you'll see with depression symptoms is a folate deficiency or folic acid deficiency, B12 deficiency, and even vitamin D deficiency. Now, we're going to talk in more detail about micronutrients and their role in mental health in our next video. So again, make sure you're subscribed to the channel. We're going to unpack this book here by Bonnie Kaplan and Julia Ruckledge on the Better Brain. And they actually talk a lot about the importance of micronutrients for mental health. And so again, make sure you're subscribed so you don't miss out on that video. Now, another factor to consider here is genetics. As we mentioned, genetics is a factor, could be a factor with depression, as some people may be just more prone to depression. However, you may also have some methylation SNPs on your genes that prevent you from, say, methylating or synthesizing folate. The MTHFR gene is one of the most common genes that are known, but there are many other methylation genes and different SNPs that can cause issues with metabolizing certain nutrients. And also, there could be a genetic propensity for you to be an inducer or inhibitor of some of the CYP enzyme metabolic pathways, and that can actually make you either more prone to side effects from antidepressant medications or metabolize so quickly that they just don't even work. Another factor to consider is the medication that you're taking treating the right neurotransmitter dysfunction that you may have? So if you're looking at neurotransmitter function as one of the root causes of depression, it could be serotonin, it could be dopamine, it could even be norepinephrine that could be causing this low mood, low energy, etc. And so if you're taking an SSRI and it's mainly an issue with dopamine, your depression isn't going to get better. And so those are just some of the main factors or underlying root causes of mental health symptoms and specifically depression. So therefore, it's important for you to be an advocate. And if your antidepressant isn't working, before being labeled as treatment resistant, first ask your doctor to have some labs done to see if you may even have some of these underlying causes. So basic labs should be like a complete blood count, a complete metabolic panel, glucose test, a hemoglobin A1C, a fasting insulin would be great to see, thyroid function test, thyroid antibody test, vitamin levels, making sure to check your vitamin B12, your folate, your vitamin D, even magnesium could be a factor. Look at inflammatory markers, check your C-reactive proteins, your homocysteine, and even your set rate. Those would be all good starting points to see if any of these root causes could be a factor in why your antidepressant isn't working. Now, you can also dig a little deeper and do genetic testing. And there's a very comprehensive genetic test out there specifically for mental health problems, and you can actually get a nutritional report along with this genetic test, and it's called My Happy Genes. I'll make sure to link that down in the description so that you can check that out. Another test to consider would be an organic acid test. Now, an organic acid test will actually look at your metabolic pathways, methylation problems, neurotransmitter levels, and it's looking at the metabolites of those neurotransmitters and the metabolites of even some vitamins. So it can pinpoint if there's any vitamin deficiency or even at the mitochondrial level, mitochondrial deficiency or disruption. And it's actually a pretty comprehensive test that can actually look and detect many of these root causes. However, many primary care providers and even psychiatrists and psychiatric nurse practitioners won't even know what an organic acid test is. Why? Because it's a functional medicine test. It's a test that's taught in functional medicine and not in regular medicine. And so you'll have to find a provider that's either trained in functional medicine or integrative medicine. You could also look at mental health coaching. For instance, I am a mental health coach. And as a mental health coach, I can help educate you and guide you throughout your treatment process. I can't diagnose and I can't prescribe as a mental health coach unless you live in Florida. I could use my psychiatric nurse practitioner license and do that if you live in Florida. But if you live outside of Florida, as a mental health coach, I could help guide you and educate you to make a well-informed decision about your mental health care and about your mental health care treatments. Also, I can help guide you in finding a provider that would be a good fit for the symptoms that you may be presenting with. So, as a mental health coach, I could also help guide you into making some lifestyle choices and making some lifestyle decisions that can help support your mental health. And so, for instance, when we're looking at all of these factors, some basic things that you can do right now to help support your mental health and improve your symptoms is going to be cleaning up your diet. So make sure you clean up your diet, get rid of those processed foods, the refined sugars, and start turning to a more whole foods diet and getting your nutrients from whole organic foods. Also, throw in some exercise. We've already discussed all of the benefits that exercise has and the research that's out there to support that exercise can actually help treat depression. So get out there and start exercising. Of course, after you've checked with your provider to make sure that you are able to participate in moderate exercise. Also, work on improving your neuroplasticity. Don't forget about that video we just did on neuroplasticity and how you can improve your neuroplasticity. So working on those tips will also help to improve your mental health symptoms. Now, if you want to look at your neurotransmitters and if you're interested in looking at whether or not you're maybe having symptoms of serotonin deficiency or is it dopamine deficiency, there is actually a neurotransmitter assessment form that I have that you can fill out. Just click on the link down in the description and sign up to receive that neurotransmitter assessment form. Along with that neurotransmitter assessment form, there will also be an interpretation form, what each of those sections mean, how to interpret your results, and then apply it to your current symptoms. And so there you have it. Those are the top reasons why your antidepressants may not be working. Are there any other reasons that you can think of? Go ahead and put them down in the description. We learn from sharing each other's experiences. Also, please make sure to like this video and share it with others who may find value from this video. As always, I thank you for watching. I wish you well on your mental health care journey, and I'll look forward to seeing you next week.